All right. Next slide, please. Before we go ahead and get started, just want to have a quick few housekeeping notes for you all. If you are having any logistical questions related to the webinar, please go ahead and use the chat function and type them in there. Have colleagues there who will assist you. We will also want to be sure to answer any content-related questions that you have. So please, again, utilize the chat box function. Any answers to any generalizable questions that's raised during this webinar will be made available on our frequently asked questions page on our website following this session. Also to the webinar recording, slides, and transcript will be made available as well. We will not be recording the we will record rather the Q&A portion of this. However, we will not post that. Next slide. And once again, want to say good afternoon and welcome everyone. My name is Albia Altine Gibson, and I'm the Managing Director of Racial Equity Grant Making at Health Resources in Action, also known as HRIA. And I am really pleased to welcome you all to our webinar announcing the 2024 grant making cycle for the Massachusetts Community Health and Healthy Aging Fund, which we'll be referring to frequently as the fund. Health Resources in Action is a nonprofit consulting organization serving governments, nonprofit, philanthropies, and communities across the U.S. And our mission is really to help people live healthier lives and create healthy communities through prevention, health promotion, policy, and research. I'm also joined by my colleague, Chen Hens, Program Associate, who will be presenting with co-presenting with me today. And I also have Emily Breen, who will be in the chat, tracking the chat and answering questions as we go along when it's something that we can answer relatively easily. Next slide, please. Our objective for today, first, we really hope you will gain a better understanding of the background and rationale for the funds, including what our priorities are around racial and health equity and policy system and environmental change approaches. Also, too, we'll share more information on the upcoming funding opportunity, including the process, some key dates, and available technical assistance so that you all know. And just a quick note too, if you're not able to apply for this grant making cycle, there will be other opportunities in the upcoming years to apply for these fundings. Next. This is a quick at a glance of the key dates and information for this funding opportunity. The intention is to put out about $15 million this time around. So we expect to award anywhere from 20 to 25 awards. The grant period will ideally start July 1st of 2024. And we have the eligible applicants, Massachusetts-based nonprofit organizations, groups with 501c3 fiscal sponsors, quasi-government organization, and municipalities are all eligible to apply. And as far as some eligible activities, community-centered approaches that really disrupt barriers to health and their root causes, and including structural racism, poverty, and deep power imbalances are eligible activities. And the application deadline will be March 29th. Just also very briefly, and we will touch upon this a bit more deeply, but wanted to say this in the beginning. Current grantees of the fund are ineligible. And there are some slight deviations from that, and we can talk to those folks as needed. Hospitals, for-profit businesses, colleges, and universities are not eligible to apply as lead applicant for those, though they may, if they are serving as an anchor organization could potentially partner with a community-based organization. And in terms of ineligible activities, capital expenditure and research are not eligible. And so we will jump right in now to the background and rationale. The funds this grant making opportunity is disseminated resource via the Massachusetts Community Health and Healthy Aging Fund, and it's made possible through a partnership between the Massachusetts Department of Public Health, DPH, Health Resources and Action, and the Executive Office of Elder Affairs. And in 2017, the Department of Public Health completed a revision to their determination of need regulations, which we'll share about in the next slide. And this led to the creation of the fund. HRIA serves as the fiscal agent that's responsible for facilitating the planning implementation of the funds. And we were selected through a competitive bidding process. DPH oversees the overall funds program. And EOEA makes decision in partnership with the Department of Public Health to provide expertise regarding the healthy aging funding stream, which we'll talk about later. And so what is the determination of need program? It is the result of healthcare institutions such as hospitals or long-term care facilities who enter into an effort to expand or improve upon their facilities. A percentage of, so they apply to this program, and a percentage of the total expenditure of the overall cost for this project is invested into the funds. And really the idea is that the funds will then utilize these specific statewide determination of need dollars to create these grant making opportunities to ensure that organizations who and communities who have not benefited from DON dollars traditionally based off of their location are able to have access to some of these DON dollars. And so in addition to the three partners that I mentioned before, in 2019, the funds established an advisory committee, and their goal is really to guide the overall directions of the funds. And so resources, and so that's one of our convening bodies and partners that we work with. Resources are then directed to these three funding streams: policy, system, and environmental change approaches, community health improvement planning, and healthy aging. When we talk about the fund's vision and mission, the funds are committed to really disrupting and removing barriers to health. We are addressing structural and institutional racism, poverty, and other deep power imbalances through looking at community-centered policy, system, and environmental change approaches. And we provide resources to really enhance the capacity of like multi-stakeholder collaborative to really authentically engage residents to work together so that everyone has the highest quality of life in Massachusetts. And community engagement plays such a large and impactful role in this work. And we're really intentional in ensuring that those most impacted are present and working hand in hand with decision makers to conduct the work of the funds. The goal of this particular effort is, again, to advance public health in Massachusetts. And we know that 80% of what influences our life expectancy does not happen in a healthcare system. It happens outside of a healthcare system. And it further highlights the point that where we live, where we work, where we play, where we engage has a huge impact in our ability to thrive and to be healthy. What we have here is our equitree. And what do we mean when we talk about health? So when we think about this equity here and what it's demonstrating, um, the health of the tree or the health of the community essentially is really important, that we're looking beyond just what's happening at the surface. We're looking beyond what's happening. So when we're looking at this here, we see that leaves include some health outcomes here: hypertension, depression, and the branches are health behaviors that we're looking at. And oftentimes, sometimes we kind of stay in this realm and think about, like, what approaches we need to do here in those spaces. And those are valuable and important. With the funds, what they're doing is taking a deeper dive, looking at the roots, those social determinants of health that you see listed here. Those are not all inclusive of all the social determinants of health, but some of them. And then looking at root causes of health and underlying systems that impact those, such as sexism, racism, poverty, structural and institutional barriers. And we work at those levels to address those root cause issues, to produce better health outcomes, with what we're seeing on the leaves. So there are some key terms too that we want to share with you all as we're thinking about the approach to this work. We see the difference between so we have the definition here of disparities or inequalities and inequities. We see disparities as differences between individuals or population groups. And we see inequities as differences that are necessary and avoidable, but are also unfair and unjust. So an example of that is people with darker skin are more likely to die from melanoma, even though they are less likely to develop or get melanoma. This disease is often found at later stages with people with darker complexion, and the lack of images of what melanoma looks like in darker skin, as well as the education that's provided and accessibility for screening levels, is a disparity that we're seeing. And so the funds really seek to focus on and address inequities. One more piece of defining health equity. It's really important to do that. And here's the definition that our advisory committee for the fund adheres to. The term health equity is defined as everyone has a fair and just opportunity to be as healthy as possible. To achieve this, we remove obstacles towards health, such as poverty, discrimination, and these deep power imbalances that we mentioned in the beginning. And their consequences include things such as lack of accessibility of good job, fair pay, quality education, et cetera, et cetera. And so it's really important that as we consider advancing health of population, that health equity is also at the center of the work that we're doing. And we see the quote here with MLK, where he states, of all forms of inequality, injustice in health, excuse me, let me restart that again. Of all the forms of inequality, injustice in health is the most shocking and the most inhumane, because it often results in death. And so with the funds, we're really looking to address health equity with this work. Now I'm going to pass it along to my colleague, Chen Chen, who is going to talk to you all a bit more about the approach.
Hi, everyone. My name is Chen Chen. I'm the program associate here at HRA. I'm happy to be here with you today and to talk about the approach of this funding opportunity. One thing that makes this opportunity unique is its core tenet of policy, system, and environmental change approaches. You will hear us talking about this throughout this presentation. So this is a really important because we believe these approaches have the greatest potential to impact some of those root causes of health that we are mentioning through the visual of the tree and its roots, specifically structure and institutional racism. So there are three areas that we will fund. One is policy, system, and environmental change, which is the PSE change. And then the community health improvement plan, which is the also called a CHIP, and then healthy aging funds. So the first of the three funding opportunities we will briefly talk about is the PSC, or policy system and environmental change. So not only is this a key concept across the funds, it's also a specific funding opportunity. Approaches can range across a variety of social determinants of health and health outcome areas, as long as they are working towards PSE change. So you might be asking, what is PSE change? PSE strategy are a way of making sustainable, lasting change within a community to support healthy environments and behaviors across populations. The strategies create or change infrastructure and modify the context in which people live to improve community conditions that promote health. Policy system and environmental changes are often made in combination with each other. The PSC awards can be up to 200,000 per year for up to 5 years. So on this graphic here, you will see this is a comparison of the PSC change approach versus a more traditional public health programmatic approach. The programmatic approach is on the left-hand side of the screen, and I will share this first example. Organization hosting a community bike ride as a programmatic approach. But for PSC change approach, people might implementing a complete streets policy to ensure community roads are designed to be safe and accessible for all users. The second example is having an open gym night at a local school to encourage residents to exercise. And then a PSE change approach is implementing a town-wide joint use agreement enabling community members to have access to the school's gym and fields when school is not in session. So you can see with that example, the PSE change approach is a more sustainable approach, and it also has the potential for longer term impact on more people. So as we are thinking about this funding opportunity, we really want to focus on the right-hand side of the screen, which is the PSE change approach, and we want to do that with an equity lens, as Albia was referring earlier. And throughout all these different examples, we want to recognize the importance of community engagement and community-led processes and centering health and racial equity. And dive into some PSC awardee examples. Here are a few examples from current grantees. You can visit our website for brief descriptions of all grantee projects too. This is meant to just spark your thinking about your own approaches. The first is addressing housing instability and barriers to healthy living for residents through the development of a new building, which includes affordable housing units and a grocery store, pharmacy, health center, and more. So this can be considered as an environmental change. The next one is addressing food insecurity through one, establishing a food policy council, two, developing and enacting comprehensive urban agriculture policy, and three, transitioning a farm from a farm to pantry model to a farm to retail model. This can be a policy and system change. The last one is intervening at the level of governance or decision-making in institutions to craft more inclusive structures that eagerly welcome people most impacted by health inequities to be involved in decisions that directly affect their lives. So that's a system change. The next funding opportunity is focused on community health improvement planning or CHIP process. A CHIP uses community health assessment data to identify priority issues, develop and implement strategies for actions, and establish accountability to ensure measurable health improvement, which are often outlined in the form of CHIP. A community health improvement process looks outside of the performance of an individual organization serving a specific segment of a community to the way in which the activities of many organizations contribute to community health improvement. A community health assessment gives organizations comprehensive information about the community's current health status, needs, and issues. The information can help develop a community health improvement plan by justifying how and where resources should be allocated to best meet communities' needs. So in this is a graphic that shows the 9 steps of community health improvement planning process, including conducting a community health assessment and developing implementation strategies. This funding opportunity is designed to support entities working at any point in this process. CHIP awards can be up to $375,000 total over 3 to 5 years. Here are a few examples of funded CHIP projects. Again, these are meant to be an illustrative list. We encourage you to be creative and create approaches unique to your own community. The first is implementing a community health wellness plan through sustained coordination, capacity building, and training, inclusive and representative leadership and participation, fundraising, and progress tracking evaluation. The second one is City Health Department building a diverse and equitable collaborative with the purpose of closely examining the city's community health improvement plan to ensure all populations are represented in an equitable manner. The last one is city currently completing the final year of its first CHIP and developing a second CHIP. Through this grant, will further strengthen community engagement, data development, collection and analysis, and evaluation during the life cycle of the CHIP with an emphasis on racial equity indicators. The next one is the healthy aging funding opportunity, also focus on addressing social determinants of health and root causes of health inequities through policy, system, and environmental change, but also has its own distinct focus on to improve physical, social, and economic conditions for older adults. And on this slides, we have the 8 domains of livability framework as we identify by the Governor's Council to address aging in Massachusetts. They include transportation, housing, social participation, communication and information, civic participation and employment, respect and social inclusion, community support and health services, and outdoor spaces and buildings. We want to recognize the connectivity of all of the domains for the funding cycle. Preference will be given to the approaches focused on the areas of housing and transportation, but applicants can address any one of several of the domains. Healthy aging awards can be up to $100,000 per year for 3 to 5 years. Here are a few examples of funded healthy aging projects. So the first one is conducting a health impact assessment on policy and practice proposal that affect the ability of people with a criminal record as shown through a criminal offender record information query check to secure housing. So this is a policy change. Creating and disseminating a guide that promotes inclusive, age, and dementia-friendly practices with an overarching goal to encourage culture change that leads to communities more thoroughly considering the preferences, needs, and experiences of all people. So this is a system change. And addressing barriers to safe walkability in the region through policy advocacy, education, environmental change identified in walk audits. Now we're going to talk about something new at this funding cycle, which is the planning funding. Additionally, the funds will take applications from organizations that seek to move from short-term time limit efforts, which is the programmatic approach, to long-term sustainable approaches, which is the PSC change. Planning grants will support planning, technical assistance, capacity building, and learning for emerging healthy aging CHIP and PSC approaches. Recipients of planning grants are welcome to apply for a full grant in the next funding cycle. However, funding is not automatically guaranteed for planning grant awardees. For all the three funding streams, the planning funding is up to 50,000. The funding period is 1 to 2 years. So I'm gonna pass it to Albia to talk about the grant making process.
So as we're thinking and talking through what the next processes are, currently we are at the funding opportunity announcement. You can please visit our website next week for the RFP application links and other materials, and we will provide application supports during January through March for these are optional support technical assistance for folks who may want to come in and just learn more, and in addition to asking questions as well. The application deadline, as we mentioned before, is March 29th, 11:59 p.m. Eastern Standard Time. And the application status notification will be sometime around June when we will let people know. So about 2 months after your final submission, we will let people know where they lie in terms of whether they received the funding or were declined. And again, the timeline at the moment for the grant start date is July 1st of 2024. So we briefly touched upon some of the eligibility and priority eligibility, but I'm also talking more about the priority populations for the funds this time around. So in order to apply for the funds, you have to be a Massachusetts-based nonprofit organization, 501c3 status. And there were some questions asked in the chat where it's a bit more nuanced. So we certainly will, if you all have some additional questions or need some clarification, we encourage you to send us an email with those. Organizations or group with 501c3 fiscal sponsors, quasi-governmental organization, and municipalities are eligible. And so in addition to that major requirement for this round of funding, the funds will prioritize support to communities that have not historically and routinely benefited from previous local determination of health fundings and that have high level of health inequalities. This includes communities outside of Boston, more specifically for the PSC and CHIP, and then for the healthy aging, the gateway and rural areas for the healthy aging funds are also prioritized. Strategies may focus on a geographic or population-based communities at the local, regional, or statewide level. The funds will accept applications from agencies and organizations that are geographically based in Boston. However, they are doing work and have contacts and community. They're doing health and racial equity work on a statewide bases or in communities outside of Boston. And just another note too, we prioritize community-based organization where staff and leadership are reflective of the populations that they serve. Next slide. And so we mentioned ineligible applicants and activities. And again, some questions were addressed in the chat. And for more nuance, we encourage you, more nuanced questions, we encourage you to send us an email so we can better understand the framework in which you're working within on the our email. But current grantees, hospitals, and there's an asterisk with the current grantees because there are some lines for applicants that we can speak more clearly to if there are questions for that who may qualify. Hospitals, non or for-profit businesses, and colleges and universities, private or public, are not eligible to apply as lead applicants. But in places where they play key roles as anchor institutions, so we understand that there may be some areas who those entities are some of the primary anchor institutions. We ask that they participate and look to connect with a community-based organization who would be the lead applicant, and they can partner with those groups to enter into to apply for these funding opportunities. Hospitals that have contributed to DON funds are not eligible to receive any fundings within this as well. So if you're a hospital entity that you've contributed towards the DON funds, they are not eligible to receive fundings from them as well. And ineligible activities include general capital expenditure and research. And so how to apply? We really ask that you will review the RFP once that is out and start developing your proposal as soon as possible. As I mentioned before, we will have some TA sessions for folks to help support folks throughout the application period. Those sessions are optional, but if you would like, if you have more questions, would like those technical supports, we can assist. We really encourage folks to visit our webpage and visiting the webpage to really, because we are going to have a online portal where you will get to where you will submit your application through an online platform, and we'll be asking some questions such as your organization, project information, and then there'll be some narrative questions that you will be asked to respond to. These application process was made very streamlined to really support organizations and your time spent on this work. And I will pass it along to Chen to talk to you all a bit more about the proposal formats and more nuanced detail related to the grant making process.
Thank you, Albeit. Now I'm going to talk more about the application process. We offer two proposal formats, narrative documents and presentation slides format. You're welcome to use either one of those two formats for your proposal. You can use a mix of bullet list, narrative writing, and visual media. Just please make sure that you include enough details for review process. So narrative document we suggest 4 to 6 pages. Please don't exceed more than 6 pages, and presentation 20 to 25 slides. For our RFP and our application portal are not released yet on our website, but I want to give you a foretaste of the application questions. In the application portal, you will need to answer some of the question in three major areas. One is organization information. That includes organizational group name, total annual operating budget. Is your organization BIPOC-led? Is your organization lived experience of oppressed led? And then the second area is the contact information. The third area is a project request information, including project title, amount requested, geographic area served, social determinants of health of focus, populations impacted, and capacity building needs. CHIP and healthy aging have a few additional questions. CHIP will include the stage of your CHIP process, additional CHIP process in your region, existing CHIP planning group. Healthy aging will ask you to select which 8 domains of livability framework that you will work on. For narrative questions, includes a summary of your project, applicant group description, approach and activities, key partners and collaboration, community engagement, organization equity efforts. Each funding stream will have its specific question related. Planning grant has a slightly different questions. Again, please visit our website next week for more information. We also ask you to include those attachments, budget, work plan, and W-9 tax exempt document. We want to let you know that your proposals will be assessed based on 5 major criteria. The review committee will be looking for this criteria when they review your proposals. One is alignments with funding purpose. Does the proposal demonstrate a history of and or outline strategies to disrupt and remove structural barriers to health through community-centered upstream policy system environmental approaches? Does the proposed project support the fund's vision? Second one is, does this proposal has alignment with funding priorities? Does the proposal serve geographies, populations experiencing high risk of inequities that have not historically and routinely benefited from DON dollars? Third one is community engagement. Does the proposal outline strategies to connect with community members and key stakeholders? How will community members with lived experience of health inequity be involved in the leadership, design, implementation, and evaluation of activities? The fourth one is collaboration and partnerships. Does the proposal demonstrate a history and or a plan to engage diverse partners? How will power and decision-making be shared among key partners? The last one is budget. Does the budget align with proposed activities? Is the proposal feasible? So now I'm going to talk about some next steps. As LBN mentioned, that we will provide some application support during the application period. Some of the topics including the more details in depth of PSC change. Then we will go through the IFP and talk more about eligibilities. Third one is community engagement, and then health and racial equity, evaluation and theory of change, and navigating the application portal. You need to register before attending, but please know that those TA sessions are not required. So you will find those information on our website, also through our email communication. We also offer 3 funding stream office hours. Those are not mandatory either. So you can choose which one you want to join based on your interest. The program officers from each funding stream will be there to walk through details with you and answer your questions. So one is the CHIP one is next Wednesday, 10 to 11 a.m. Healthy aging is next Thursday, 1 to 2 p.m. and the PSE one is next Thursday, 2:30 to 3:30 p.m. So here is our website. Please visit next week for our RFP, other materials, and application links. Before we wrap up, we wanted to make sure you have our contact information. We set up a general email account that you can submit your questions to for this funding opportunity. We will use MACHA funds@hrra.org.